So welcome everybody. This is our final session of the PEACCH webinar series looking at healthcare adaptation. And I'm delighted to welcome all of my speakers here today. We're going to have a really fantastic session. It's been great looking at the feedback that we've had from some of the from the first three sessions of the PEACCH webinar series. And we're looking to round that off today with a session that's going to take us through a range of tools and processes and principles that you can hopefully take back to your own institutions to start thinking about climate change adaptation and what you can do. So hopefully we'll leave you feeling inspired to do more, not concerned that there's nothing that you can be doing, but also having a pathway and a way of working through things. So as you can see, PEACCH is the project to embed adaptation to climate change within healthcare. And it's a project that's made up, it's a collaboration between researchers at the University of Cambridge's engineering department in the Centre for Sustainability, but we're also joined by colleagues from Anglia Ruskin University, Yorkshire Ambulance Service and Mid and South Essex Integrated Care Board. Obviously, we're also joined by a range of wonderful speakers from lots of different organisations. And whilst Morgan is talking in just a second, I'll reshare the speakers programme so that you can have a good look through all the other sessions that we've run, have a look through the speaker bios as well, just in case there's anything that you've missed. I should also just mention that the sessions are funded through an impact acceleration grant, and that's joint funding from the EPSRC and ESRC. As I mentioned, this is the final webinar in the series. So the first three webinars took us through an introduction to climate adaptation in healthcare. We then took a closer look at heat risks and how they're impacting on the health system and what you can do to address some of those risks. We had a couple of really great sessions on that one as well. And then session 3, which was on Monday, looked at flooding and drought risks, so everything to do with too much water, not enough. And we'll touch again on water in Mariam's session today. Unfortunately, she wasn't able to join us on Monday, so we'll have a little bit more on water, but also then integrating some of that data into governance systems. So as I mentioned, today is all about the tools for adaptation and what we can do to embed them within our organisations' processes and procedures and practices. So first of all, we're delighted to have Morgan Roberts from Sustainability West Midlands. She's going to be talking us through the NHS Climate Change Adaptation Framework, which has just been adopted by the NHS, and also the associated Climate Change Risk Assessment tool. Peter will then be talking us through sustainable procurement and how we can start thinking about sustainable procurement and the circular economy, but from an adaptation perspective and what we can learn from that. You'll then have me talking us through some principles for thinking about making adaptation positive investment decisions and what you need to start to embed and principles that you can adopt throughout any investment decisions to make them adaptation positive. Karen will then be talking us through NHS Commercial Solutions' new framework that's looking at sustainable estate solutions. And then we'll be back to Alexis, who you've heard speak on some of the other sessions, and she'll be talking us through how to find creative ways to fund adaptation, acknowledging that sometimes you have to be a little bit sneaky or a little bit creative and inventive. Sneaky is probably the wrong word, but creative and inventive about where you're going to get investment funding for this. And then finally, we'll round off with Mariam, who will be walking us through a case study of a drainage system, so a sustainable urban drainage system at Anglia Ruskin University, but thinking about how we need to start embedding some of the data and analysis from interventions that we're doing into our governance systems. So it's sort of trying to tie that all off with trying to understand whether the interventions that we're doing are actually making the changes that we are trying to achieve. And then we'll have Q&A as per usual just at the end of the session, and a few words of reflection from myself, and also any of the speakers are invited to do so as well towards the end, and we should be finished for 1:30. So without further ado, then Morgan, the floor is going to be yours. If I can ask the other speakers to put themselves on mute as they have done already and turn their videos off, I'll hand over to you. Thank you.
Thank you, Louise. Sorry, I was just, you all disappeared, so I couldn't turn myself off mute. I'm assuming you can hear me and see my slides?
We can, and we can.
Amazing, great. Thank you very much. And thanks, Louise, for having me here. It's a pleasure to be able to speak to you all about this topic. And it's really exciting to see that there's so many people working on it as well. I often feel like we're isolated talking about adaptation sometimes, so it's really nice to see how much work's being done. My name's Morgan. I work for an organisation called Sustainability West Midlands. Despite the name, we're an independent advisor, independent organisation. We work on sustainability in all aspects of the word. You can see the 8 priorities that we look at in the top right there, and we work on those across the West Midlands region, but also far beyond that as well. Our goal is to support all sectors to become more sustainable, fairer and greener. A lot of that work includes adaptation. A lot of the work that I deliver as a project manager is around climate change adaptation, and in particular with the NHS, we've been supporting for the past few years, both in kind of one-on-one consultancy with different organisations, helping them with their adaptation, but also through some funded projects to deliver resources, such as some of the ones I'm going to go through today, delivering some training on adaptation in the NHS, and also now through a UK-wide project called the MAC Hub, the Maximising Adaptation to Climate Change Hub, which is looking at adaptation across all different sectors, including health. So that's who we are and why we're here, despite the West Midlands name. Today, we're going to talk about kind of the fact that true resilience is about embedding adaptation throughout your organisations. It goes beyond just those hard measures, or beyond even just having an adaptation plan. And hopefully I'll have given you an overview of adaptation policy and requirements for the NHS as well, and then go through those 3 main pieces of guidance available to support your adaptation planning and delivery. I won't go over this slide in any detail at all, because how climate change impacts health and healthcare and what adaptation is has been covered in the previous webinars. And I think somebody's just talked about how to access those webinars in the chat a moment ago. So if you want to go back and watch those, if you'd like more context on adaptation and climate change in general, so I won't go over these in any detail. But as a really quick reminder, we're talking about adapting to the impacts of climate change. So for healthcare, that can look like anything from supply chain and utility disruption to increased health conditions and demand, like the ones on the slide here. It's important to understand some impacts will happen regardless of our net zero efforts. So we need both, and also that climate change is a thing of the present, not the future. You know, we're already experiencing impacts our systems are not fit to manage. Hence why we're all here to discuss this today. So as we've also learned in webinars so far, adaptation is about reducing exposure and vulnerability to impacts of climate change, and therefore that's not only about those physical assets. Some examples are on the slides here, but being able to deliver adaptation is not only about being reliant on having a plan. A list on someone's desk is only useful if systems and resources and expertise are in place to ensure that these are delivered effectively, hence why we're talking about embedding adaptation today. Before I introduce the 3 pieces of guidance about embedding adaptation that I'm going to go through, I wanted to give some policy context. This is obviously the most fun bit of the presentation, so please excuse the dryness. I'll go through this as quickly as possible, but I think it's important that we all kind of understand the policy context for the NHS and for England more widely. So DEFRA hold the responsibility for the government's delivery of climate change adaptation for England. The Climate Change Committee is an independent organisation. They do an independent assessment of UK climate change risk every 5 years. The next one's coming out next year. They also do other things like tracking progress to climate against adaptation and progress against net zero for the government. So basically providing information and monitoring for the government's progress on climate related things. DEFRA will formalise that independent assessment every time one's published, and then produce this national adaptation programme. So if you want to understand how the government says they're going to oversee England's adaptation response in general, then the most recent one's the NAP3 in 2023, and that's the place to go. There's also something called the Adaptation Reporting Power. It's a body that organisations in the UK could submit climate risk and adaptation progress to. For healthcare, UKHSA and NHS England submit to the Adaptation Reporting Power through the Health and Care Adaptation report, the fourth of which was submitted this year. So again, that's one piece of national policy that NHS organisations can use, if you so wish, to understand your responsibilities and opportunities for adaptation. The other one mentioned here is the Adverse Weather and Health Plan, which is much more about responding to adverse weather like heat waves and flooding, but it's still important to be aware of. I thought now would be a good time to recognise there's much to be done nationally to support adaptation in the NHS. There's very limited resource or direct support for delivering adaptation. This was reflected in the Climate Change Committee's report last month, which stated that healthcare is one of the areas that remains most poorly prepared in the UK. The reason I wanted to say this was to recognise that those of you here today, I'm sure, have many other competing pressures around your work and around your ability to just deliver effective healthcare. And we recognise that adaptation is not supposed to be an extra on top of that. It's not just a nice to have. This is something that really is actually essential to being able to deliver effective healthcare, as has been demonstrated by the Climate Change Committee. As I've already alluded to, however, there is an increasing amount of guidance out there for planning and delivering adaptation. I'm going to focus on these three main ones today, with a major focus on the Climate Adaptation Framework. This was developed in with the fact in mind that adaptation needs to be embedded and ongoing. After me, of course, there'll be other tools also really helping you embed adaptation in existing practices by the other presenters. So to talk about the Climate Adaptation Framework first, the context of this is that Scotland have something called the Adaptation Capability Framework for the public sector. This was produced by an organisation called Virture. Last year, we worked with Virture together with other NHS organisations as well on a project to develop a version tailored specifically to the NHS in England, as well as developing pieces of training and a couple other resources as well. This is now official NHS guidance. So I'll take you through today kind of what it is and how you use it within your organisation. So the framework's based on the concept that an organisation's got capability for adaptation that determines how good you're currently at adapting to climate change. It's more than just having an action plan, as I've said, and it will also need more than just the people here today to enable and deliver adaptation. It also doesn't have a simple end goal. You can't be fully adapted, which makes it quite intangible sometimes. So that's why we've taken those intangible concepts and condensed them into 4 capabilities that we believe every NHS organisation needs to be able to effectively and sustainably, as in the long term, prepare for impacts like flooding and severe weather and reduce your exposure and vulnerability to these. So we hope that measuring your capabilities is a good way to measure progress for something this complex in the absence of simple metrics, and goes beyond just having a plan of measures. So the first capability is around understanding the challenge. That's about being able to make informed decisions about actual or expected change. It includes gathering evidence on your organisation's climate risks and vulnerabilities. It's not just having a risk assessment sat on someone's desk or computer, but climate change being integrated into your corporate risk register, having staff that understand how this relates to their own work, for example. And then there's organisational culture. This is about making progress, with adaptation really only being possible if it aligns with the rest of your strategies and the rest of your policies. Over time, adaptation should be embedded and resourced and mainstreamed into your plans, policies and procedures. It should be part of business as usual, basically. Planning and implementation wise, we know adaptation is an ongoing challenge. Like I said, things change, so we have to be flexible with our planning, and adaptation plan's only the start. You need to have systems in place for monitoring and evaluating your progress. You need plans to deliver specific activities and plans for what to do if the evidence that comes in is different, for example. Oops. Slid through a bunch, and then working together is the last one here, and this is basically about the concept that adaptation or climate change impacts us all in really complex ways and interconnected ways. There's lots of cascading impacts and interdependencies. So, for example, there might be issues with transport that mean that your staff or your patients can't get to your sites. Now, that might not be your responsibility to deal with road infrastructure or transport infrastructure, but it really impacts you. So working together internally and externally is really essential to be able to actually deliver kind of addressing those systemic issues that cause that reduce our resilience to climate change. So that capability is around how to work together, how to forge partnerships with key partners and share ideas and find opportunities to collaborate for adaptation. And it also talks about making sure nobody's left out of that conversation as well. So those capabilities that I've just gone through, they're broken down into a total series of 43 practical actionable tasks. These are suitable for any NHS organisation to progress their ability to understand, prepare for and respond to climate change. There's 4 maturity levels as well for each capability. So from starting to mature, this can be used to assess your current capability. So you can have a look at these 43 tasks and think, which of these things are we already doing? Are we not doing? Have we had progress in any of these? Are some departments doing this and some not? Help you understand what your maturity level across your organisation is for those 4 capabilities. Important at this point to recognise that it won't be the same across all of them as well. You might feel, oh, well, we've done a detailed risk assessment and we know where our gaps are, we know how we're going to be impacted from climate change. But actually then when we look at the orange one there, the organisational culture and resources, we haven't engaged with colleagues about potentials for opportunities for adaptation. We haven't got specific people responsible for addressing those risks. So there might be, you might be advanced or mature in one and starting in the other, but that helps you identify where your focus should be and who might need to be involved in addressing those challenges. You can also see it as a checklist to identify your gaps and see what you should do next, as well as finally understanding the long-term goal that you have for what adaptation and what good looks like. You can look at the mature level and think, okay, that's what we should be doing once we get to a really mature level of adaptation. But also digests it and brings it into those steps so that doesn't feel overwhelming. There's a further guidance document which is available, which talks you through more detailed advice on carrying out each of the 43 tasks and links to other resources and guidance for those specific tasks as well. There's a lot of stuff out there, and sometimes it can be hard to know what you should use and when, and keep track of everything available. So the document should be your first port of call, as it links to all those other resources when they'll become relevant to you. That's the climate adaptation framework. The second piece of guidance is the climate change risk assessment. So that's a spreadsheet from NHS England, which you can work through to create your own risk assessment for your site or your organisation or your system as well. We weren't involved in the development of this tool, so I can't tell you much about it in detail, but there are, but what I can tell you is that it talks about identifying your climate related risks, about understanding what the impact of those be, the severity of those impacts, and then also start identifying some options. And then really importantly, those last 2 bullet points there talks about how that relates to the rest of your strategic objectives as well. So how do we maintain service continuity and deliver effective healthcare, and how do we support our net zero commitments as well? So it talks about how to integrate that into the rest of your work. What I can tell you as well, though, is there's various resources available to help you do your own risk assessment, which can inform this spreadsheet template if you wish. So there's things linked here like the Local Authority Climate Service and the Local Climate Adaptation tool. They're both really user-friendly online tools I'd recommend, because you can see local climate projections or climate impact information for your local area summarised in a really accessible way. Adapt to Survive is a guide that we developed a couple of years ago, even though it doesn't specifically give you guidance for this spreadsheet. It does guide you through how to understand climate projections, what the numbers mean to you, and what the climate risks mean to you, no matter your previous experience in this area. And it also links to other external resources, such as the Environment Agency's flood risk maps, which is the other link that's there. Finally, the last thing is around the green plans. So hopefully you're all aware of green plans. They cover the 9 areas of sustainability, including adaptation, and all NHS trusts and ICBs have to have one. And the next refresh is due October this year. On the screen here is the guidance in the NHS England Green Plan guidance, specifically the stuff on adaptation. The other things that it does is reference key documents like the EPRR core standards, the NHS standard contract, and the climate change risk assessment tool that I've just mentioned. So this is kind of what is recommended for you to do in your green plan. But to provide some more in-depth support in completing that, SWM and Virtue have developed this adaptation plan template and a guide on including adaptation in your green plan. This includes throughout it suggestions on what you should be including on adaptation, where in your green plan and how. It says you should start with stating whether you've got a risk assessment or adaptation plan or not. If you don't, you should state when you're intending to produce one by. If you do, you should state when they were last updated and published. You should state who's responsible and involved in producing, reviewing and implementing your plan. But the key thing here is that if you have an adaptation plan, this document helps you simplify and kind of grab information from that plan and put it in your green plan effectively and in compliance with the green plan requirements. And if you don't have a adaptation plan, it helps you work through some of the real basics to go from having basically very little adaptation progress to the start of a real plan. So whether you have a plan already or not, this guidance hopes to take you through these 5 categories are on the screen there, and provides links again to other resources to help you carry those out. One I want to mention in particular is the 5th one here, which is really important when it comes to embedding adaptation. So the other references throughout the rest of your green plan to adaptation. There's examples of things throughout the green plan guidance that should relate to adaptation actually. So things like they ask what specific improvements would you most benefit from, or would most benefit your local communities, rather your staff and your overall organisation. This is obviously really relevant to adaptation, as knowing areas most at risk from climate change and adapting to those can support all of your other goals. You know, you can't effectively get to net zero if you're having to respond to emergencies that mean you have to use carbon intensive equipment, for example. So being more prepared helps you with those goals as well. Also, it asks for maps, so maps with demographic or socioeconomic information you're including in your green plan. Those can also be cross-referenced with your flood risk maps or your heat maps that help you understand who's most vulnerable. So those are just some examples of how to kind of embed adaptation throughout your green plan, not just in the adaptation section that are included in this guidance. So hopefully all of that overview has been helpful to show you what's available to help you embed adaptation in your work. All of the resources I've mentioned are free and open source. Most of them are accessible on a website called We Adapt, which I'll link to in a moment. And there's also on We Adapt further details and reflections from the project we did last year, where those resources were developed if you're interested. And then the rest of them are on the NHS England website. I just wanted to do some key takeaways though first before I finish. So we know that adaptation is not a nice to have, and it's also not only about environmental sustainability, but it's really necessary to achieve your other strategic priorities and objectives. You know, everything from business continuity to effective healthcare to improving public health. So hopefully it's been clear that adaptation needs to be part of all of those things to make sure that our healthcare service is resilient. There are tools and resources available to you, although we do recognise the strain and the fact that resource can be tight. So effective leadership and governance is really, really essential to make sure that you can deliver adaptation, even if the guidance isn't coming from top down all of the time. So taking bold steps, exploring innovative and collaborative opportunities for adaptation can always demonstrate that this is a priority at a local and regional level to the national level. You know, we really recommend sharing the impacts that you've had and sharing the adaptation you're doing to help spread awareness and share that, you know, this is actually something that can really help deliver all of the rest of your objectives. It's not just an extra, and it's not something that can be ignored much longer. Got some next steps for you as well as recommendations, because I know it's a lot of stuff all at once. So these are kind of the things I'd recommend to be your first port of call. See whether your organisation or any of your partners have got an adaptation plan already, or whether you have climate change in your risk register, or perhaps partners within your integrated care system also do, which can help you, you know, learn from their best practice and not reinvent the wheel. Please use the resources that we've shared when updating your green plan this year, and also share any of the resources with your colleagues that you think they might be relevant to. The next thing would be measure your adaptation maturity using the climate adaptation framework. Have a look through all of those tasks on a high level, see which ones you feel like you've completed and which ones you haven't, and therefore start to think about how to move up to the next maturity of adaptation and plan some next steps. And then finally, just let me know if you'd like to remain engaged in this topic. We're always doing work on adaptation, and we're very often working with the NHS in that. Even if it's not a one-on-one consultancy piece, we've got a lot of work there where we're trying to engage the NHS more generally and feed from the bottom up as well. So feed international policy through DEFRA and through the Department of Health and Social Care, etc. So please do let us know if you'd like to remain engaged. So yeah, thank you very much. I think my details are on next slide. I'll hand back over to you, Louise.
Fabulous. Thank you so much, Morgan. It's clear you even got a not just claps, you've had a heart emoji as well. So thank you. It's great to have Morgan on. She and her colleagues have been doing so much work in this area for a good few years as well. So it must be nice. I feel like we're sort of a place where things are sort of slowly gaining traction a little bit. Right. Thank you. Next up, I'm just going to go back to my program. Next up, we've got Peter. He's from the Brighton and help me out, Peter.
Sussex,
Apologies.
Brighton and Sussex
Brighton
Medical
and Sussex,
School.
it was the S. Brighton and Sussex Medical School. And he's going to be talking us through the future of sustainable procurement and what this means for adaptation, thinking about the circular economy and sustainable procurement, but really looking at that from an adaptation perspective. So, Peter, if you'd like to share your screen and Morgan, dear, I need to put my teeth back in. Over to you. Thank you.
Can you hear me, see the slides all right?
Yes, I can. Thank you.
Good afternoon, everybody. Thank you so much, Lois, for the lovely introduction, for the warm welcome, and for the opportunity to be speaking here today. My name is Peter. I'm a research fellow for sustainable healthcare and circular economy at the Brighton and Sussex Medical School. And today I will present to you briefly on the topic of how circular economy in clinical procurement can be used as a climate adaptation strategy for trusts in NHS England. Two small caveats before I continue. First of all, the main focus of my presentation will be on how can we use circular economy practices in order to ensure the adaptability of our supply chains, rather than how do we use circular economy practices to procure for adaptation, although the latter topic is also important and I will touch on it towards the end. Additionally, due to the nature of my work, the presentation focuses on the local context of NHS England, but I'm absolutely certain that the key takeaways and practices that can be taken from here could be applied and adopted to any healthcare organization in the world. So, to embed the theme into some context, NHS England annually spends around £3 billion on clinical procurement, and this is data that only covers procurement from NHS supply chain, doesn't cover direct contracts and other group purchasing organizations. The institution liaises with over 115,000 suppliers from all over the world and procures annually more than 20 billion each. We also have significant indication that more than 95% of those are likely disposable, and we are basing this estimate on analysis that we've done in our own consumption in the US Sussex NHS Foundation Trust, where we've analyzed the top 95% of procurement and found out that 99% of it is disposable. I've also included some metrics on climate mitigation, including carbon footprint and waste, but I'm not going to pay too much attention to them because I think it's important to understand what these metrics actually tell us in terms of climate adaptation. The data on this slide indicates that there is a huge annual turnover of the things that the NHS England procures. There is an underlying reliance on disposable supply chains and single-use supply chains, which are majorly sourced in countries that are susceptible to climate change risks, including countries in Southeast Asia, Pakistan, Bangladesh, India, and some of the coastal cities in China. This puts the system as a whole in significant risk from climate disruptions across the supply chain, to the point where they could have detrimental effects on the quality of care that the institution and local trusts could provide. Recently, I've had the opportunity and the great pleasure to analyze the green plans that Morgan just introduced. I've analyzed the existing iteration that was published in 2021. And as she said, climate adaptation is one of the 9 topics that trusts need to report on in these documents. Our thematic analysis showed that none of the trusts have thought about clinical procurement from the perspective of climate adaptation. And in fact, only 18% of the trusts have addressed supply chains in their climate adaptation plans, with 63% of them referring to broader business continuity rather than the specific topic of procurement. It's also worth mentioning that none of the trusts had SMART commitments in supply chain adaptation, SMART being the abbreviation for specific, measurable, achievable, relevant, and time-bound. And this is a bit of an indicator that will, even in the places where commitments on supply chain adaptation have been present, these not necessarily of the best quality. These data kind of indicate two problems. On one hand, there is a failure to frame adaptation as a supply chain issue with trusts that have actually engaged with the sustainability of the supply chains, focusing predominantly on mitigation rather than adaptation. But also it's indicative of a failure to understand supply chain as an adaptation issue, with trusts engaging with adaptation more focused on estates and facilities, existing infrastructure, and even travel and transport. As Morgan said, guidance has been updated, so I'm going to really quickly gloss over this slide because she really explained it very well. One thing I think is worth mentioning is that there is no explicit guidance on addressing supply chain and procurement, but as she mentioned, there are a lot of relevant examples and tools that allow trusts to address it from a systemic level, which will definitely have an effect on the procurement processes as well. The bottom line of the presentation so far is that the system as a whole is in risk in terms of supply chain adaptation, and trusts are failing to engage with it significantly right now, and existing guidance fails to, well, doesn't fail, but does not specify how to address this this problem. In the context of these challenges, we want to put forward the concept of circular economy not only as a mitigation effort, but actually as a potent strategy for climate adaptation. This begs the question, first of all, what is a circular economy? It is somewhat of a radical rethink of the linear mode of consumption, which currently states that when an entity needs something, they buy that something, they use the something, they throw it, they don't use it anymore, and then they toss it away. By contrast, a circular economy seeks to maximize the value of a product over its life cycle and tries to prolong this life cycle via various strategies, which invariably start with an R, be it the reuse, refurbish, remanufacture, recycle. A circular economy is useful in the context of climate adaptation for two reasons. It both allows to build local capacity and improves the supply chain resilience. First of all, moving to circular economy decreases procurement volumes and costs, which unlocks additional resources and capability for trusts to address adaptation issues. Additionally, it increases local capacity to meet demand, altering the supply chains and allowing organizations to move away from volatile supply chains. This will be an apt solution to the problem that I mentioned earlier, and allowing the NHS England to move away from this susceptible supply chains that I mentioned. And finally, if a world leader such as the NHS and such as England adopts circular economy, this will have a great influence on international trade and would potentially foster a global circular economy, which will prepare more and more healthcare organizations and countries for adaptation. Additionally, circular economy fits really well into the framework for adaptable supply chain procurement, which has been recently published. It goes without saying that circular economy seeks to prolong the product's life cycle, which relies on strategies such as maintain and repair, but it also prioritizes products that are resilient towards climate change. A high quality product that is meant to be reused or refurbished would have is much less likely to be affected by climate disruptions rather than a syringe for 10p. Finally, it also allows for engaging with suppliers that are willing to work on the adaptability of the supply chain, and anecdotal evidence of our current work with circular economy suppliers shows that these are the suppliers that are willing to engage with sustainability, to engage with mitigation, to engage with adaptability. The question, however, doesn't end here, and there are other avenues for further research that need to be understood. First of all, when it comes to circular economy in clinical procurement, we need to ensure the adaptability of the circular infrastructure that is enabling these processes. And these are facilities for decontamination and sterilization, without which circularity in healthcare settings would be impossible. We need to be able to adapt those to the impending climate changes as well. Additionally, it would be worthwhile to explore how can we translate the principles of circular economy to wider procurement practices, whether that will be non-clinical procurement or procurement for adaptation. And finally, and perhaps the most significant challenge that we're looking at, is how to ensure the system-wide engagement, the quality monitoring and reporting that will mean that these changes have made a significant and meaningful change with regards to adaptation. So, in conclusion, supply chain adaptation remains an important and pending problem in front of trusts of NHS England, and circular economy practices could provide a solution by decreasing the reliance on volatile supply chains. However, more research is needed to embed the cultural shift, to understand the change and how can we best adopt it in order to adapt the system to climate changes. Thank you so much for your attention. And yeah, I'm looking forward to any questions in the Q&A session later.
Thank you so much, Peter. That was fabulous.
Thank you.
I'm now going to share my slides again and take you through the 12 principles for adaptation positive investment decision making. So this suite of principles for adaptation positive investment decision making was grounded in some work that I undertook last year in relation to the Life Resistor project that was mentioned by Federica in the first session. That project was EU funded and involved pilot hospitals from several European countries. And we looked at how organisations were making adaptation decisions, how they were choosing the right solutions to adapt. And what we found was that people were often not familiar with the kind of interventions that were available. They didn't understand how to make adaptation positive decisions or how to start to incorporate adaptation positive decision thinking into what they were doing. As a result, we developed a suite of principles that could be applied. So rather than trying to develop another toolkit or a different process that people needed to add on to existing procurement processes, we thought that taking a principles approach would be a useful way of doing this. So we've got, and actually thinking about it in the context of the adaptation framework that Morgan has just talked through, it really does start to embed with some of those capabilities that they were talking through. So the first one is around having the right procurement environment. The second group of principles are around understanding your challenges or your situation. And then the third one is then using that understanding and those that procurement environment to start to choose the right solution that is the most adaptable or has the best adaptive output. So I'm just going to talk you through some of those things now. So if we're thinking about things from the procurement environment, the first thing that you need to do is to ensure that there is a golden thread. So what I mean by this is that you have a sustainable procurement strategy in place that actively addresses climate adaptation and sets out that the organisation is looking to address climate adaptation within its procurement actions. The second one is around developing climate-ready relationships. So this is relationships with your suppliers and your supply chain, making sure that they are adapted. So thinking about some of the things that Peter was just addressing in his previous presentation, but also thinking about the need for making sure that you and your suppliers are ready to be innovative and adaptive. So that links to some of the things around contract flexibility, in that if you are tied into really long-term contracts with particular suppliers on particular products, and that is quite common in healthcare, that means you might not be able to change to products that make you more adaptive. And that can also go for climate change mitigation as well. If you're stuck in these very static relationships with your partners, or you tend to only go to them if you know exactly what you want, rather than being able to address things in a more innovative way and a more developmental and experimental way, then you might not be able to take advantage of some of the changes and ways of finding a new innovative solution. So I've mentioned contract flexibility, and just thinking about how you can start to weave in changes to products or changes to the way that you're doing things to take advantage of that development and innovation going on in the area. And quality monitoring and reporting is really important when we're designing contracts, that if we are designing them to address particular adaptation challenges, that we make sure that the key performance indicators, the data that we're collecting on how that product is being, or how that solution is being embedded within the organization, that data is feeding back so that we can make better quality decisions in the future. If we don't have good quality data about how well it's going, then we might buy the same thing again. And if it's not effective, we would be potentially using some of our funds and resources to reinstate poor quality decisions. So we need to have those things embedded to make sure that we are actually procuring things that are being chosen on the basis of their adaptation positive contribution, but also we're checking to make sure that they are positively contributing to our adaptation. The second suite, and although they are numbered, they're not necessarily meant to be taken in a particular order, but the second suite of principles are a group that focus on understanding your adaptation requirements. And this is, again, looking at the understanding your challenges. So when you are if you have a good understanding of your challenges that you're going to be facing in your organisation, you've done your risk assessment, you understand your critical sites, your vulnerabilities, your exposures, your critical infrastructures and processes that you want to take place, then you can start to think about what you need to address those things whilst accounting for certain things and avoiding other things. So the two things that we want to account for is we want to account for multiple risks. So if we're making decisions about investing in something, it's probably going to be a more sensible solution to address something that, or to choose something that perhaps addresses it might address air quality risks as well as heat wave or heat risks, or it might address heat and cold, it might address heat, cold and water management risks from extreme weather. So if we can account for multiple risks in the products or the solutions that we are procuring or investing in, we will be hopefully making a more effective use of the resources that we do have, rather than doing things piecemeal and addressing each one in turn. If we can do that with a systems thinking, that will be beneficial. And that also then links to accounting for interconnectivity. If we think about a failure in this part of the organisation is going to cause a knock-on impact over here, then we understand how the system works together and how an intervention in this area might have the most effective intervention output or contribution to adaptation. The second sort of grouping within this this group of four is around avoiding, and there are two things that we need to avoid. So the first of all is several of the things that we might choose to do, for example, to address heat risk, might involve also increasing our energy demand. So installing new fans, or installing air conditioning units or non-passive ventilation. All of those things that we are doing will be also potentially contributing to emissions, which is what we don't want to do. We want to try and avoid contributing to additional emissions where possible. Sometimes that may not be possible, but we want to at least try and avoid them if possible first. And we want to avoid maladaptation. And by maladaptation, we are thinking about if we adapt in one area and reduce a risk or a vulnerability, but we cause a risk or a vulnerability to either another part of our own system, or we kick it further down the lane, and we make sure that we then ensure that there are other organisations or other people who might be affected by the consequences of our own adaptation. So whilst we're adapting, we're causing poor adaptation elsewhere in the system or outside it. For example, we might protect ourselves from flood water, but move that flood water towards, say, a care home that then becomes a problem that we need to address. So we need to be considering those things in our procurement decisions. The final group of principles are around products for the future. So when we're thinking at a particular product level and we're making an assessment on and making a business case for a particular choice, we need to take into account a variety of different things. So we tend to think about just the financial costs of the upfront costs, or the cost to procure and install something. But we need to think, when we're thinking about adaptation, about the costs not only to install something and maintain it, but also the costs that you're going to avoid. So if you are avoiding a flood by installing particular flood barriers, then you're going to also avoid the costs of some of your flood cleanup, or the costs of delayed services and things like that. So we also need to factor those things that you're avoiding by installing those things into our decision making. And the same goes for future supply chain in the future supply chain environment. So what does this future supply chain look like in the next 5 to 10 years? If the products that we are looking to procure require an ongoing maintenance program that requires something that is likely to become very hard to come by, or might be outlawed because of prescribed, then we need to think about maybe choosing other options that mean that we have a more stable supply chain. And the last two sort of go hand in hand. One of them is thinking about the future operational environment. So if you are making particularly very big procurement decisions for infrastructure choices in particular, that tend to be assets that might be around for 10, 20, 30 years, think about the kind of future operational environment that asset will need to work in. Will it be able to function in extreme temperatures? Will it be able to, will we need it for the kinds of future services that we might need to be providing? Where should it be if we're going to be needing to move things around? And that links into the final one there, which is around future configurations. So thinking about the spaces that we take up and the ways that we organise our services. If climate change is going to mean that we are going to need to deliver different care to different people in different places and with different products, how can we design our spaces to make sure that they're a bit more flexible in their layout? Can we design them in a way that means that they're not stuck? A lot of healthcare infrastructures tend to be really quite static, and it means that we're not necessarily designed to be flexible and adaptive. So then, taking adaptation action, I'm going to leave you on this slide. But taking adaptation is the result of either the decision to take action or the requirement to take action to do something. And that action, your ability to take that action, is kind of constrained by a number of things. And that is thinking about understandings of what is appropriate to manage a particular risk, so your organization's risk appetite, but also what's available and accessible. What have you got access to help you? Also, what people know about. So the people who are making key investment and procurement decisions, what are they even aware of that's on the market? If people are only aware of a very small selection of solutions for a problem as they understand it, they will probably choose from that small pool. If we can make that pool wider, we will have much better access to different potential solutions. But it also links to what people care about or think is important, and that what people care about and think is important is driven by policy and legislation, but it's also driven about the different timescales. Are we thinking about the patients that we are adapting to now, or are we thinking about a future patient that we're trying to adapt for? That links to historical events and things that you've experienced already, the way that we interact between decision makers and who holds ultimate decision-making authority or power or gets to influence decisions. And then really it also is really influenced by processes and procedures. So can we start to embed adaptation even in people's thinking processes to make sure that they are thinking, this decision that I'm making about single-use plastics, does it also have, as well as a mitigation and a decarbonisation aspect? Is there an aspect that if we made a different choice, would that make us more adaptive? So I will leave you with a call to think about within your own particular sphere of influence. We've got people here from different functions and elements of the healthcare system. Which factors do you think that you might be able to influence? We can't necessarily influence all of them, but we each have a certain amount of power and agency in the things that we do. So At that point, I'm going to hand over to Karen Amber, and Karen is from NHS Commercial Solutions, and she's going to be talking us through their new Sustainable Estate Solutions framework. Karen, I'm going to be driving your slides for you, so if you just give me a moment to find them, then you can just Chris Whitty to your pleasure, and just ask me to move on when you're ready. Can you see that?
Brilliant. Thanks, Louise.
Thank you.
So good afternoon, everyone, and thank you, Louise, for the welcome and for inviting me to speak today. My name's Karen. I'm the Sustainability and Social Value Lead at NHS Commercial Solutions, and I'll be sharing insights on our Sustainable Estate Solutions Framework Agreement today. I won't be going over what adaptation is or what the risks are, as I've already had some excellent presentations throughout this series covering that. So instead, I'll showcase some solutions and how you can access them. Next slide, please. So over the next 10 minutes, I'll give a very brief overview of our organisation and what we do. Then I'll focus on our Sustainable Estate Solutions Framework Agreement, how it was developed, how it delivers sustainable solutions in a sustainable way, our next steps and the framework update, and finally, how to procure those solutions. Next slide, please. So NHS Commercial Solutions is one of the 4 NHS National Collaborative Procurement Hubs. We're an NHS accredited framework authority. We're all NHS employees, but our services cover the entire public sector. We work in partnership with the 3 other procurement hubs, with the European Health Procurement Partnership, several academic institutions and private sector partners. We're not for profit. Any of our surplus activity-based income is put straight back into the NHS. We also have member trusts and local authorities who we work with on several projects, including geospatial data and analysis to understand the risks and needs of their place and impacts on the wider system, either nationally or internationally. Next slide, please. So I'm not going to go all through this, don't worry, it's very text heavy, but we provide services and support across a wide range of markets, as you can see. But today I'm going to be focusing on estates and facilities, and specifically our Sustainable Estate Solutions Framework Agreement. Next slide, please. So it's important to cover why and how the Sustainable Estate Solution Framework came about, really, and to share the research and work that goes into developing a framework agreement. So when I came into the post just under 2 years ago, to get a feel of what the NHS Trust had planned, I scoped out green plans from across the country. Very few had even a mention of adaptation. Mostly were focusing on decarbonisation. So there was a huge gap there. There was also a gap in the market where frameworks were concerned. Again, scoping out framework agreements available, I found there was a focus on decarbonisation. Now, I know from experience that climate change poses a risk to the running of our services. As a clinician, I've seen that over the past 10 years, the impact that heat has had on operating theatres, for example, and the disruption that heat can cause to service delivery. So this framework was crucial. I had to get the business case over the line and get to develop it. After all, I will, and no doubt many of you will be needing those services over the next 20 to 30 years. So if we don't adapt, then how will we care for ourselves and our communities and uphold that NHS pledge, care from cradle to grave? So then it's about pre-market engagement, both with potential suppliers, exploring all of the solutions out there, all those green technologies, and also with the public sector and NHS Trust. What do they know? What will they need help with? And what can we cover on the framework? And then it was really about identifying sector risks. After all, we're delivering sustainable solutions. We need to ensure that we deliver them in a sustainable way. Otherwise, we're just trading off our health for the health of the planet and the global population. Next slide, please. We embed social value missions into the framework. This is a legislative from the public procurement notice, and I won't go through them all, but when the slides are shared, you'll be able to take a look. We have under legislation to give a minimum of 10% weighting to these missions within the tendering process, and as you can see, that many of the elements there are high risk for some of the adaptation solutions, things like tackling modern slavery, waste in the circular economy, etc. Next slide, please. So the benefit of this framework is that it's a compliant route to market. It carries a 20% social value weighting, and we contacted the UN to gain permission to align each of the service lines or lots with the Sustainable Development Goals. We had over 200 suppliers apply to be appointed, but we actually only awarded 36 suppliers to the framework. And that's for a number of reasons, but mainly because of the strict sustainability requirements that we put in place. Next slide, please. So what does the framework include? Well, consultancy services. We've heard on previous presentations about green plans and climate risk assessments, but do our estates and facilities staff have the skills or time for these initiatives? The consultancy services can provide that support as well as many other services, design, architectural, ecological services, or specific works consultancy. The building remediation covers sustainable solutions to adapting the estate. Again, previous presentations have covered the risks from heat and water, so I'm not going to go over that again here. And the works or building remediation has all of the solutions needed, as well as in the nature-based solution lots. And of course, we have the power element and decarbonisation and mitigation services, as well as bespoke services, because actually it might be that we can support our suppliers to work in collaboration on specific projects. For example, if you wanted biosolar, you might need consultancy, solar and green roofs. We're refreshing the framework to include new solutions and green technologies under the new Procurement Act 2023, and we'll be going out to tender very soon to welcome new suppliers with new technologies onto the framework. Next slide, please. So how can you use the Sustainable Estates Framework? Well, contracting authorities, trusts, public sector organisations have two options to call off the framework: through a mini competition or direct award. A direct award is compliant if the supplier performs all the required services, all of the proposed terms and conditions without the need for amendments or additions. And if that is the case, then you can go for a direct award to a specific supplier. Or for a mini competition, it's the opposite. A mini competition is a mini tendering process that invites suppliers on a specific lot to bid, so the contracting authority can ascertain capability, determine costs and amend the terms and conditions. When a contracting authority wants to procure via the framework, which is compliant and reduces the workload immensely for procurement teams in trusts and organisations, they can contact us with their query, and we can then supply them with access forms, user guides and support them through the whole procurement process. So often in the NHS and wider public sector, we are told what we need to do. This is a framework that can help you actually do it, actually achieve those outcomes. And we've already done a lot of the work for you and provide the support you need to realise your projects, to adapt the estate to climate change and ensure we minimise disruption to our NHS service delivery and build resilience to climate change across the public sector. Next slide, please. So thank you. Do reach out if you'd like to find out more. I think we're taking questions at the end. So that's it from me. Thanks, Louise.
Thank you so much. That was fabulous. Really good to hear about not just that there are things out there but you're already doing a lot of the legwork to make it so much more efficient use of people's time and effort. So next up we have, apologies. We're now going to come on to Alexis Percival from Yorkshire Ambulance Service again, who's going to talk us through some creative ways that you can use to try and fund adaptation, investment and procurement, and to get investment into your organisation to get that adaptation done. So Alexis, over to you if you'd like to share your screen and come on the call.
Thanks very much, and hello everyone. So first of all, let me say a big thank you to Louise for coordinating all of this webinar series, which has been really insightful and really interesting. And I would hasten anybody who hasn't already seen the previous ones, go and watch them. They're fabulous. So just a way of an introduction, I'm Alexis Percival. I'm the Energy and Sustainability Manager with Yorkshire Ambulance Service, and we've been looking at climate adaptation through lots of different things across our region for a while. And I just want to kind of touch on some of the funding adaptation processes that you need to look at. Sometimes adaptation is down to phrasing, and the different people that you need to have involved in the strategy for getting engagement is huge, and where you can weave those things in is through your estates, through climate adaptation, through your resilience operations, stating the green agenda, looking at medicines, local nature recovery strategies, biodiversity capital investment programs, looking at your adaptation, social value, business continuity, EPRR, and your fleet. All of these are a way that you can get adaptation embedded within your organisation. But what we need to look at is how we actually get the funding for this. Number one on your starting list is having a climate adaptation plan. You know where the problems are, you know where different issues need to be addressed and funding looked for. I put public sector decarbonisation in there, the PSDS. It is no longer the PSDS, and we need to understand where we need to go for looking at stuff. A lot of our adaptation measures would be embedded within our PSDS plans going forwards, but until we have the funding pots available to us, we don't know where we can get that funding through that government funding routes. As I was putting this presentation together, the UK infrastructure strategy, the 10-year strategy, was issued, and this actually, I'll touch on it in a little bit, is something that potentially there could be some funding pots that come out of it. As a 10-year strategy, we'll wait and see what actually is identified. As part of that, the GB Energy programmes will also be in there. Biodiversity and biodiversity net gain is something we can utilise a lot for climate adaptation and funding pots. So through the local nature recovery strategies, LNRSs, and the tree planting schemes, there is loads of opportunity that we can look for nature-based solutions. But also there's things like sustainable urban drainage and the larger landscape strategies and plans that we need to be part of, and also that funding can come into NHS trusts and healthcare systems to look at that. Business continuity is a really key part of this. If we invest in adaptation through BC plans, we can ensure that we have that embedded. Planned maintenance is also a really key part, and it's ignored in most adaptation aspects, but having a planned maintenance regime and scheme is a really key part of this. So having your gutters cleaned, having your interceptors, your drains, and anything that will cause flooding, that may cause overheating, is another key part of that. We also need to kind of get stuff embedded in our natural upgrade schemes and our processes going forward. So looking at car parking schemes, we can look at having SUDs embedded within that. Looking at roof upgrades, you can get your solar and various other measures in place to embed that, but also your general estates upgrades are a key part of that. For those that are lucky enough to be part of the NHS Hospitals programme, there's also measures that you should and can get embedded in there as well. Stakeholder engagement is a really key part of this, because there are many parts of people across your organisation who may not know that we need to adapt to climate change, and certainly don't think about it when they are putting their funding bids together or putting their tenders in. All of these things, all of these different organisations, and there's a key part I haven't embedded there, so my apologies, is procurement. Estates, ground maintenance, fleet, operations. If you've got a hospital system or a healthcare system that's through PFI, they need to be part of that conversation as well. The community is a really, really key part of that, and they become part of that EPRR Local Resilience Forum conversation as well. Councils and LNRSs on a wider scheme are also part of that bigger conversation, because they again have access into different funding pots that we may not have access into. So I mentioned the 10-year strategy for UK infrastructure. These are the things that are in the government's funding bids, and we need to understand how we fit into that structure. Many of it is landscape and larger land scale aspects and things, but we need to look at, so flood defence, key part of that is looking at protecting properties. Some of those properties will be NHS somewhere along the lines, and having nature-based solutions as part of that. There is also resilience standards and mapping and updates that are part of that, that will be part of that critical infrastructure as well. There's also quite a lot of biodiversity and environmental protection that's embedded, that can also be part of climate adaptation. So looking at B&G, Nature Restoration Fund. So there are various different mechanisms that we can look at. Marine recovery is less of a thing that we look at, but there's stuff that we can use through social value as part of that. There's also environmental outcome reports, spatial planning, and the green infrastructure as well. So all of these will have a pound sign attached to them, and they will trickle down in various different projects regionally and nationally. So keep an eye open for what's going on there. But the key aspect as all of this is we need to understand what our estate is. And I showed this on our flood talk. This is the Flood Mary flood ready house. This could be a flood ready hospital, flood ready or heat ready or whatever. You need to understand all of your adaptation measures that you need, and then they just should become business as usual retrofit. And when we're looking at backlog maintenance, a key part of it is ensuring that you are fit for the future. So whether that be for flooding, whether that be for heat and overheating, all of these mechanisms need to go in, and all of them need to be promoted through what we're doing as well. So funding through lots of different routes is a key part of how we adapt.
Thanks, Alexis. I know that funding is always a bit of a tricky beast to talk about, that given that there is no one pot of funding just available for adaptation, and therefore really useful overview of the different ways and different routes into getting things done that you might have available to you. I'm going to hand over now to our final speaker for today and for the webinar as a whole. That is going to be Mariam Imani. So bear with me 1 second, I'll just share my screen again. So Mariam's going to be talking us through a particular case study of the use of sustainable drainage systems at Anglia Ruskin University, but also more specifically thinking about how you can start to incorporate monitoring and data into your good governance arrangements. So Mariam, if you'd like to
Yes.
take the screen, then
Sure, thank
the floor
you.
is yours.
Okay, let me just try. Oh, hang on. Okay. Right. Can you see my screen?
Yes, I can.
Fantastic.
Yeah, your slides.
Yeah. Good afternoon, everyone. My name is Dr. Mariam Imani, and I am an associate professor of water systems engineering, as Louise mentioned, at Anglia Ruskin University, based in Chelmsford campus. And I'm going to talk about some of the pilot projects on sustainable drainage system we've done, myself and my team have done on our campuses. And I'm so glad I'm the last one, because a lot of things I wanted to say already sort of covered by excellent speakers. And thanks, Alexis. I'm glad you mentioned about the infrastructure strategy, because it made my job much, much easier. Okay, skipping the stage. The only point I would like to raise here about the research I'm doing. I'm a water engineer. My research very much focused on wastewater and drainage infrastructure resilience, and I'm a member of a number of sort of organization working groups that they primary focus is on climate adaptation and specifically on sustainable drainage systems, nature-based solutions that a few times mentioned today. So when it comes to the challenges around climate as a water engineer, these water-related challenges, I can summarize them. Either we are dealing with too much of it, too little of it, or too dirty. And pretty much the scope of what I'm going to talk about that around SADS and the projects we do is one way or another try to tackle one of these issues. I put this slide just in case because I wasn't quite sure about the skill set we get in the seminar, but here we go. Sustainable drainage systems, again, is a set of techniques that sort of combines engineering with natural techniques in order to manage the surface water runoff. It tries to mimic the nature, and as you can see, a few pictures here, some types of them. Syria sort of captures around 14 types of them. That in any new developments now is incorporated into the landscape. The design principles around that usually summarize around four aspects. Either it's designed to tackle water quantity or water quality aspect. It offers biodiversity benefits is part of its design, and of course it offers a lot of, creates better places and offers a lot of social benefit, including health. In the UK, as already explained, again, thanks to Alex's mention about UK infrastructure 10-year strategy, a sample of some of the documents that is being used in the UK around SADS design, and basically, and a review was done in January 2023, which sort of is called Schedule 2, is part of flood and water management that mandated the incorporation of sustainable drainage system into any new developments, but we are yet waiting for that to be enforced. And in the UK infrastructure 10-year strategy just published this month, and I'm reading it at the moment, this has been emphasized around different aspects of nature-based solutions that it can be used for as means of climate adaptation in the country, which I recommend you take a look, because it talks a lot about economic infrastructure as well as social infrastructure that includes healthcare and NHS as well. There are many exemplar projects because these systems, sustainable drainage system, requires a multifunctional design, and it offers multiple benefits. One of the very famous refurbishment project, which I very much like it, is Eden Dock in Canary Wharf in London, which created a space that it looks nice, and again is a very exemplar project of the multifunctionality of it. A number of hospitals also adopted, again, incorporation of sustainable drainage systems in their buildings, and you see some examples of it. One of them is this retrofitting rain gardens in Basildon Hospital, which was part of I think, a sponge project, which was funded by Horizon 2020, is another example of that, that creates an environment that can tick all those boxes that I just mentioned around SADS pillars. In terms of the research that we do at ARU around that, again, our vision sort of, I can map a life cycle for sustainable drainage system as another type of infrastructure. On the demand and planning side, design and I say construction side, I would say pretty much this is relatively a very mature space, although this still needs innovation and improvement, but I think it is very better understood. But when it comes to adoption, maintenance, monitoring later around refurbishments, reconstruction, reuse, and finally maybe towards the commission, this is an area far less explored and understood. And our research, although it tries to focus on the left-hand side of this cycle, but at the same time, we very much in the projects I'm going to show you, we are focusing particularly this stage around maintenance, adoption and maintenance side of it. There are a number of challenges. I can categorize them. I have outlined some of them. I don't tend to read all of them to you, but perhaps a few ones I can pick up is around, first of all, from an institutional point of view, fragmented roles and responsibilities is one of the key barriers here. But at the same time, poor understanding of long-term performance of SADS is another problem. I always say that without these deeper understanding of their performance in long term, they become part of the problem in the future than solution to the problem that they're primarily designed for that. And lack of data and evidence about this performance is something quite evident that is needed in order to inform the decision making around their maintenance, around their any improvements to design construction we need, and so on and so forth. I have highlighted this in red because the next few slides I'm going to talk about pretty much focuses on better understanding long-term performance, and in particular around monitoring aspect of it. The first project we did, it was in our hydraulics lab. We created some pilot monitoring projects, pretty much around maintenance regime in hydraulics, Chelmsford campus. As you can see, this model that you can see here is an infiltration trench. They usually are implemented along the roads, highways, usually to receive the surface wash-offs, including sediments and pollutions. They are quite effective and low-tech, but quite effective systems if well maintained. What we created in this lab, in order to better understand the performance, we created some fast failure scenarios here. So it allowed us to bring the future to present. And we created a number of maintenance regime by building sediments that deliberately built up in this model, and then monitored how the infiltration rates. And we used imagery facilities, cameras, multispectral cameras, again, to monitor how the flow regime on the surface will change. Additionally, we looked into capabilities of these systems, again, in for example, pollution removal, something like microplastics, for example, as you can see here. And also, again, different seasonal changes, for example, by leaves that they create a clogging on the surface. So this was pretty much something in a very controlled environment in the lab we tested, and we have published that in International Water Association journal. We called it Health Monitoring of Sustainable Drainage System. When we decided to take it to an outdoor space and use the university campuses as our test bed. This is the Peterborough campus. It's a small campus. It's been a part of a master plan by the Nene River. And they've got a number of sustainable drainage system features, as you can see, well, sort of a print roof. They've got grass swells, attenuation bases, rain gardens they've got. And what we did basically, again, we set up some monitoring station. Currently, it's been buried under this. It was around May time that it was buried, and you can't see the stations. But we pretty much geological, hydrological, and metallurgical aspect of this, and also with the cameras, CCTV cameras, also used to monitor the growth of, for example, grasses, and again understand how it affects the hydraulic performance of these systems, basically. So and that this is exactly the instrumentation plan we proposed when we collaborated with the state to better understand their performance over time. We did the same thing in our Chelmsford campus. We've got smaller scale grass swells in by the Tyndall building in our campus. We created one here. This is one of the stations, and then again, this is the monitoring box, and powered by a solar panel. We have to hide it because it's open to public. It's a public space. Just fear of being vandalized and all of that. You need to find some ways of hiding and tackling this issue. But yes, we monitored again around the grass growth by the cameras we've got by that oversees the grass well, and also moistures, and of course meteorological data. All of these data are loaded to a dashboard data. At the moment is a domestic launch, sort of based on all three campuses and different stations and locations, and we look into different parameters. Some of them are read from the local databases, some of them are directly fed by the stations that we are monitoring, and we are using for the plan is to use them for wider research and educational purposes. And finally, as you know, ARU is about a year that Retail College has been merged with ARU. So it's one of our campuses in Chelmsford. This one is a larger partnership. So Retail campus pretty much is a peri-urban rural area. It's got a massive farmland in here, and it's got some flooding issues. We partnered with Transport City Council, Essex County Council, Environment Agency, Essex Suffolk Water, Essex and Suffolk Rivers Trust, Farmers Union, and so on. We did a scoping workshop, and currently we are in the process of this the partnership to now bring whatever we experience around those monitoring and performance to retail campus in a larger extent as part of a catchment-based approach. And the vision is to create a demonstration lab that we can showcase, we can test, and we can promote practical application of nature-based solutions. And this is going to be a regional partnership, and as we speak, we had this workshop in May, and the idea is to, again, further feed into that dashboard and try to better understand the long-term performance of nature-based solutions and SOTs in this space. In summary, a few takeaways from my end. When it comes to embedding SOTs monitoring for good governance, or generally any monitoring for good governance, and you need to move from compliance to performance, means moves governance beyond just the tick boxing to accountability through evidence-based decision making. And again, this is something that monitoring is something, again, this in the new infrastructure strategy is greatly have been emphasized. Data drives decision. This is important. Again, it informs all life cycle stages of investment in better climate resilient strategies. It enables what works, basically. It shows us what works and what doesn't work. So supports replication of best practices across, again, I mentioned NHS and public infrastructure, but it can be any infrastructure. It is a strategic and it is essential. Again, monitoring needs planning, funding, and skill sets. It's not optional, it's vital at the moment. I was reading yesterday the report again, and NHS, or social infrastructure is called in this report, that the government £6 billion per year of NHS capital investment. Again, I'm not qualified to comment on that, but that's a snapshot from the report. In my view, is a strategic opportunity to deliver resilient, green and adaptive facilities, and certainly monitoring could be somewhere there could be incorporated as part of its operation. And eventually, I believe this monitoring for good governance builds trust and collaboration. It's an evidence. This evidence empowers cross-sector collaboration and long-term impact. Thank you.